Pearls for the Starving Soul, How to Be a Good Human Being by Dr. Sheikh Qadeer, psychiatrist, episode 26, Obsessive Compulsive Disorder, December 4th, 2020. It is a time of COVID-19 pandemic and people all over the world are facing fear and anxiety, taking precautions with wearing masks and social distancing to avoid the coronavirus contamination. This becomes a relevant and important subject to talk about. It is causing distress to our lives. Obsessive compulsive disorder is an anxiety-related mental health condition. It is not uncommon disorder. It is a specific neuropsychiatric anxiety disorder that causes a person to experience uncontrollable recurring thoughts called obsessive thoughts and behaviors called compulsive behaviors that he or she feels urged to repeat over and over again. Prevalence. OCD is seen about 2% worldwide. It is the fourth most common psychiatric diagnosis after phobias, substance-related disorders, and major depressive disorders. It is slightly more common in females than males in adults, less often in children. Average age is 20-year-old. People with OCD commonly have other mental conditions such as depression, phobias, panic disorders, substance abuse, and eating disorders, PTSD, and dementias. Symptoms and diagnosis. Obsessions, that is intrusive thoughts. There is concern over contamination with germs, dirt, bodily waste, and environmental toxins. It is much related to COVID-19. Next, something terrible may happen, fire, death, illness of self or others and loved ones. Concern over need for symmetry, order, exactness. Scrupulosity, excessive religious concern, praying more than usual. Forbidden or perverse sexual thoughts or images. Intrusive thoughts of doubts, sounds, words, or music. Now the compulsions, that is the behaviors, excessive ritualized hand washing, bathing, cleaning self, checking doors, locks, appliances, etc., touching others, ordering and arranging, counting repeatedly, hoarding and collecting. Types, as said before, and those can be mild, may be able to hide the condition, and the severe condition can interfere with social and occupational functioning, can cause disability. It may affect relationship with family and loved ones. Now the associated illnesses, 50% are sudden onset, often stressful events such as pregnancy, sexual problems, death of relatives or loved ones, other psychiatric conditions like schizophrenia, phobias, depressive disorders, personality disorders, hypochondriasis, pathological gambling, compulsive stealing or kleptomania, alcohol and drug abuse. Now the treatment, those are cognitive behavior therapy and also supportive psychotherapy. Medications are antidepressant, those are SSRI and anxiety relieving medications. Reassurance and emotional support to the family and advice how to manage the suffering person. Though there is no sure way to prevent, consulting with a professional may be needed for treatment. Causes. 1. Biologically, OCD may be a result of changes in your body's own natural chemistry or brain function. 2. Genetics may have a component in the disorder. 3. Obsessive fear and compulsive behaviors may be learned from watching family members, gradually learned over time. Now the problems and management. 1. Excessive time is spent engaging in ritualistic behavior. 2. Contact dermatitis from frequently washing hands. 3. Difficulty attending work, social activities, and school. 4. Troubled relationships. 5. Overall poor quality of life. 6. May lead to suicidal thoughts and behaviors. 7. Treatment can be effective for controlling the symptoms to a lesser degree, though not complete cure. 8. Reduce the stressful situation. Do relaxation techniques. 9. Find healthy outlets like hobbies, recreational activities. Learn the ways to redirect your intrusive thoughts and compulsive behaviors. 10. Professionals may advise you the techniques to redirect your symptoms. The end. If you like, you may comment, and please do subscribe. Have a nice and comfortable day.